What if I told you that one phone call changed everything for me? My own mother, 72 years old at the time, called me from a clinic waiting room and said, "Clarence, they want to give me this vaccine and I just want to check with you first." And when she told me which one it was, I literally said, "Mom, stand up, grab your purse, and walk out of there right now. Do not let them give you that shot." And she was confused. She said, "But the nurse said it was recommended." And I said, "Recommended does not always mean right for you." That moment hit me hard because I realized something. If my own mother, the mother of a doctor, almost received a vaccine that could have put her health at serious risk at her age, then how many other parents and grandparents out there are sitting in those same waiting rooms, rolling up their sleeves, trusting completely without asking a single question? And look, before you click away or before you assume where this video is going, let me be very clear about who I am and where I stand. My name is Dr. Clarence Martin. I am not anti-vaccine. I want you to hear that clearly. I am not anti-vaccine. I have spent my career in medicine. I have administered vaccines. I believe in the power of immunization. Vaccines have saved millions and millions of lives throughout human history, and they continue to do so. But here is what I also believe. I believe that not every vaccine is appropriate for every person at every age. And I believe that once you cross that 60-year threshold, your body is playing by a different set of rules. Your immune system is not what it was at 30 or even 50. Your organs are processing things differently. Your risk profile has shifted. And some vaccines that are perfectly fine for a younger person can become genuinely problematic for someone in their 60s, 70s, or 80s. That is not fear-mongering. That is just medicine. That is just science. That is just paying attention. So today I am going to walk you through 5 specific vaccines that I, as a physician and as a son, would never let my own parents receive after the age of 60. And I want you to stay with me through the entire video because some of these are going to surprise you. Some of these are vaccines that are routinely offered to older adults in clinics and pharmacies across the country. And by the end of this video, you are going to understand why I feel so strongly about each one and what alternatives might actually serve your parents or grandparents much better. And please, if you find value in this video, hit that subscribe button. Share this with someone who has aging parents. Share it with your mom. Share it with your dad. This information could genuinely make a difference in someone's life. All right, let us start with the first one. And this is the one that almost got my mother. The first vaccine I would never let my parents get after 60 is the live attenuated influenza vaccine. Now you might know this by its brand name FluMist. It is the nasal spray version of the flu vaccine. And here's the thing, a lot of people actually prefer it because there is no needle involved. You just spray it up your nose and you are done. Sounds easy, sounds painless, sounds great. But here is what most people do not realize. FluMist contains a live virus. It is weakened. Yes, it is attenuated, but it is still alive. And for a young, healthy person with a robust immune system, that weakened virus is no problem at all. Their body sees it, learns from it, builds antibodies, and moves on. But for someone over 60, and frankly, the FDA already says this vaccine is not approved for anyone over 49, but I have seen it offered to older adults. I have heard stories from patients who were given it without being asked their age or without being properly screened. And for an older adult, a live virus, even a weakened one, can behave unpredictably. The immune system at that age is already declining. It is a process called immunosenescence, and it means the body's defense system is slower, weaker, and less precise. Introducing a live pathogen into that environment is like sending a weakened opponent into a boxing ring with a fighter who can barely keep their gloves up. It is not a fair fight, and the outcome can go sideways fast. I have seen older patients develop prolonged flu-like symptoms after receiving the nasal spray vaccine. I have seen respiratory complications, and all of this was completely avoidable because there are excellent inactivated flu vaccines specifically designed for older adults. There is the high-dose flu vaccine. There is the adjuvanted flu vaccine, and these are formulated to give an aging immune system the extra boost it needs without the risk of introducing a live virus. So, if your parent is over 60 and someone offers them the nasal spray flu vaccine, say no. Ask for the high doses or adjuvanted version instead. That is what I would do for my own mother and father, and that is what I would recommend for yours. Now let us talk about the second vaccine, and this one is going to raise some eyebrows. The second vaccine I would never let my parents get after 60 is the old shingles vaccine called Zostavax. Now, if you are watching this and your parent got the shingles vaccine years ago, sometime before 2020, there is a chance they received Zostavax. And here is the issue with it. Zostavax was also a live vaccine. It contained a live weakened form of the varicose virus, which is the same virus that causes chickenpox and later in life can reactivate as shingles. And for years, it was the only shingles vaccine we had, so doctors gave it because it was better than nothing. But the problems with Zostavax in older adults were significant. First of all, its effectiveness dropped off dramatically in people over 70. Studies showed that its efficacy in people over 80 was only around 18%. 18% that is barely doing anything. And because it was a live vaccine, it carried the same kinds of risks I just talked about with flu mist. In people with weakened immune systems, and many people over 60 have conditions or take medications that suppress their immunity, a live vaccine can potentially cause the very disease it is supposed to prevent. There were documented cases of people developing shingles-like rashes and complications after receiving Zostavax. Now, here is the good news. Zostavax has been discontinued in the United States and many other countries. It has been replaced by Shingrix, which is a recombinant non-live vaccine that is dramatically more effective. Shingrix has over 90% efficacy even in adults over 70. It does not contain a live virus. It works through a completely different mechanism. It is genuinely one of the best vaccines we have developed for older adults. So if your parent has not gotten the shingles vaccine yet, make sure they get Shingrix, not the old Zostavax. And if they received Zostavax years ago, talk to their doctor about getting Shingrix now because the protection from Zostavax likely faded a long time ago. This matters. Shingles is not just a rash. It can cause debilitating nerve pain that lasts for months or even years. It can affect the eyes and cause vision loss. In older adults, it can be absolutely devastating. So, yes, get the shingles vaccine, but make sure it is the right one. All right, the third vaccine I would never let my parents get after 60 is the yellow fever vaccine. Now, I know what some of you are thinking. Dr. Martin, my parents are not planning a trip to the Amazon rainforest. Why would this even come up? And you are right that for most people over 60, this vaccine is not part of their routine care. But here is where it becomes relevant. More and more older adults are traveling internationally. Retirement travel is huge right now. People are visiting South America, Sub-Saharan Africa, Southeast Asia, and many of these destinations require or strongly recommend the yellow fever vaccine before entry. So your 70-year-old father decides he wants to take that bucket list trip to Brazil or Kenya, and he walks into a travel clinic and they tell him he needs the yellow fever vaccine. And here is what concerns me deeply. The yellow fever vaccine is one of the most effective vaccines ever created, but it is also a live vaccine and it carries one of the highest risk profiles of any vaccine currently available for older adults. The CDC itself acknowledges that people over 60 years of age have a significantly increased risk of serious adverse events from the yellow fever vaccine. There is a condition called yellow fever vaccine-associated viscerotropic disease. It essentially means the weakened vaccine virus can overwhelm the body and cause a systemic infection that mimics actual yellow fever. It can affect the liver, the kidneys, the cardiovascular system, and the mortality rate for this condition is extremely high. Somewhere around 60% of people who develop it do not survive. Now, let me be fair. This is rare. It does not happen to every older person who gets the vaccine, but the risk increases substantially with age, and it increases even more if the person has any underlying health conditions, which most people over 60 do. So, what do I recommend? If your parent absolutely must travel to a yellow fever endemic area, have a serious conversation with their doctor about whether the risk of the vaccine outweighs the risk of the disease. In some cases, a medical waiver can be obtained. In some cases, the trip itself should be reconsidered. I would rather my father miss a vacation than take a vaccine that has a documented and age-related risk of causing a potentially fatal reaction. That is just how I feel as a son and as a doctor. The fourth vaccine on my list is the oral typhoid vaccine, also known by its brand name Vivotif. And again, this is one that typically comes up in the context of travel medicine. If your parent is planning to visit parts of South Asia, Africa, Central or South America, or other areas where typhoid fever is common, they might be offered the typhoid vaccine. And there are two types. There is the injectable version, which uses an inactivated form of the bacteria, and then there is the oral version, Vivatif, which contains a live attenuated strain of Salmonella typhi. And by now I think you are seeing a pattern in this video. The common thread is live vaccines in older adults. And I keep coming back to this because it is so important. A live vaccine in a person over 60 whose immune system is declining, who may be on immunosuppressive medications for conditions like rheumatoid arthritis or inflammatory bowel disease, who may have diabetes or heart disease or kidney problems, that combination can be risky. The oral typhoid vaccine can cause gastrointestinal symptoms that are more pronounced in older adults. It can interact with antibiotics and other medications that older adults are commonly taking. And its efficacy in older populations has not been as thoroughly studied as we would like. The injectable typhoid vaccine, while not perfect, does not carry the same risks associated with a live organism. So if your parent needs typhoid protection for travel, ask for the shot, not the capsules. It is a simple switch that can make a meaningful difference in terms of safety. And honestly, have a broader conversation with their travel medicine provider about all of the vaccines being recommended and whether each one is truly appropriate for someone of their age and health status. Do not just accept a one-size-fits-all approach. Your parent deserves personalized medical care, especially when it comes to putting something into their body. And now we come to the fifth and final vaccine on my list. And I want to be very thoughtful with this one because it is nuanced. The fifth vaccine I would never let my parents get after 60 without very careful consideration is the BCG vaccine. BCG stands for Bacillus calmette-guerin, and it is a vaccine primarily used against tuberculosis. Now, in the United States and many Western countries, BCG is not part of the routine vaccination schedule, but in many parts of the world, it is given at birth or in childhood. And there are situations where an older adult might be considered for BCG vaccination. For example, if they are traveling to a high-burden tuberculosis country for an extended period, or in rare cases, BCG has been explored for other uses, including bladder cancer treatment, and even some research into its effects on the aging immune system. But here's my concern. BCG is a live vaccine. It uses a live attenuated strain of Mycobacterium bovis. And in an older adult, particularly one with any degree of immune compromise, BCG can cause serious complications. There have been documented cases of disseminated BCG infection where the bacteria from the vaccine spreads throughout the body. This is rare in young, healthy individuals, but becomes a real concern in older or immunocompromised patients. The symptoms can include persistent fever, weight loss, and infections in multiple organ systems. Treatment requires months of anti-tuberculosis medications, which themselves carry significant side effects, especially for aging kidneys and livers. So, in virtually every scenario I can think of, I would steer my parents away from BCG vaccination after the age of 60. If tuberculosis protection is a concern, there are other strategies. There are preventive medications. There are exposure reduction strategies. There are ways to manage the risk without introducing a live bacterium into an aging body. Now, I want to take a step back and talk about why this topic matters so much to me personally and why I think it should matter to you. We live in a time where there is a lot of noise around vaccines. There are people on one extreme who say all vaccines are dangerous and no one should get any of them. And then there are people on the other extreme who say every vaccine is perfectly safe for everyone and you should never question your doctor. And I am telling you both of those positions are wrong. The truth, as it usually does, lives somewhere in the middle. Vaccines are one of the greatest achievements of modern medicine. Full stop. But like any medical intervention, they need to be applied with wisdom, with nuance, and with an understanding of the individual patient. And when that patient is over 60, the calculation changes. Everything I have talked about today comes down to one fundamental principle. As we age, our immune systems change, and our medical care needs to change with them. What works for a 30-year-old does not necessarily work for a 70-year-old, and we owe it to our parents and grandparents to advocate for them, to ask questions on their behalf, and to make sure they are receiving the most appropriate care for their specific situation. I also want to address something that I know some of you might be feeling right now. Some of you might be feeling guilty because your parent already received one of these vaccines. Please do not feel guilty. Medicine is always evolving. What we knew 10 years ago is not what we know today. And the fact that you are watching this video right now means you care. It means you are trying to be informed. It means you want to do right by the people you love. And that is all any of us can do. We make the best decisions we can with the information we have at the time. Going forward, you are now equipped with knowledge that can help you have better conversations with your parents' doctors. And that is the other thing I want to emphasize. I am not telling you to refuse all vaccines for your parents. I am not telling you to distrust their doctors. What I am telling you is to be an active participant in their health care. Go with them to appointments if you can. Ask questions. If a vaccine is being recommended, ask which specific product is being used. Ask if it is a live vaccine or an inactivated one. Ask about the specific risks for someone of their age. Ask about alternatives. These are not rude questions. These are not difficult questions. These are exactly the kinds of questions that good doctors welcome because they show that you are engaged and that you care about making the right decision. And let me tell you something else from my experience. The doctors and nurses who get offended when you ask questions are not the ones you want making decisions about your parents' health. A good physician will take the time to explain why they are recommending what they are recommending. They will walk you through the risks and benefits. They will respect your right to be informed. And if they do not, it might be time to find a different provider. Let me also take a moment to talk about what vaccines I do enthusiastically recommend for people over 60 because I do not want this video to leave you with the impression that older adults should avoid vaccines altogether. That could not be further from the truth. The high-doses or adjuvanted flu vaccine every year is critical for older adults. Influenza kills tens of thousands of older Americans every single year, and the right flu vaccine can be life-saving. Shingrix, the recombinant shingles vaccine, is outstanding, and I encourage every adult over 50 to get it. The pneumococcal vaccines, which protect against pneumonia and related infections, are vitally important for older adults. The updated co-vaccines continue to be recommended for older and high-risk populations, and the TWIP booster, which protects against tetanus, diphtheria, and pertussis, remains important throughout life. These vaccines are safe, effective, and specifically designed or approved for older adults. They use inactivated or recombinant technology. They have strong safety data in older populations, and they protect against diseases that disproportionately affect and kill older people. So, please make sure your parents are up to date on these. The message of today's video is not to avoid vaccines. The message is to choose the right vaccines. I want to close with something personal. My parents are everything to me. They sacrificed so much so that I could become the doctor I am today. And every medical decision I help them make, I treat as if their life depends on it, because in some cases it does. And I treat your parents with the same respect. Every patient who has ever sat across from me in an exam room, I have thought about them the way I think about my own family. What would I want for my mother in this situation? What would I recommend for my father? And that is the lens through which I made this video today. These are not hypothetical recommendations. These are the actual conversations I have had with my own parents in our own kitchen at our own dinner table, and now I am sharing them with you. If this video helped you, if it gave you something to think about, if it made you want to have a conversation with your parents or their doctor, then please take a moment to like this video, to subscribe to this channel, and most importantly, to share it. Share it on Facebook where your aunts and uncles might see it. Text it to your siblings. Send it to your parents directly. Information like this has the power to protect people, but only if it reaches them. And you have the power to make that happen right now. Thank you for watching. Thank you for trusting me with your time. I am Dr. Clarence Martin, and I will see you in the next video. Take care of yourselves and take care of the people you love. They are counting on you, even if they never say it out loud. I will see you next.